Hi guys, so I'm aware that your second year MBBS exams are just around the corner and you need some revision tips and paper presentation tips so you can boost your marks and improve your marks. I'm going to give you exactly that in this video. Some very practical and very useful revision tips. So watch the entire video. It will help you jump 15 to 20 marks just like that. Before I tell you anything else, let me tell you what resources I used. So for pathology, I had made notes, so I just stuck to those. Along with that, जो topic मुझे नहीं समझ में आ रहा था, और if I wanted more revision in a particular chapter, I would watch one-shot videos of Dr. Priyanka Sachdev ma'am, and that's it. बाकी सब मैंने खुद से पढ़ा है. I studied by myself. I did not rely on any other sources for pathology because I had completed it throughout the year. So for micro, most of the parts I knew, but some infections were very tricky for me and I could not remember that. So for that, I used Physio USMLE, which is this YouTube channel, जहाँ पे in a very fun way they teach you about these infections. Medicosis Perfectionalis, which I mentioned in the last video. By the way, if you've not watched the previous video, make sure you check it out because it will help you out. So for micro, basically textbook. Obviously, you need to study textbook. Bus videos pe do not rely. That's the worst mistake you could do. Study your textbook. Along with that, you can use these different resources. And for pharma, I studied by myself because I had made notes during the entire year. That's about it. Let me start with the revision tips. I'm going to tell you the paper presentation part later. First and foremost, obviously, is to focus on only the important questions. Now you only have a few days left for your exam. So close to the exam, you do not need to be studying the entire book, obviously. तो क्या करो? बस important questions पे focus करो. Study only the important questions according to your university and not somebody else's university. Second is what I like to call the 3R rule, which is to read, revise, and recall. So reading should be done by this point. Please don't study new topics. It will just create confusion in your brain. All you need to be doing is to be revising. So how do we revise? We revise by mind maps. Make mind maps. I personally love revising by scratching and scribbling. I've told this a billion times and I'm not gatekeeping anymore. I have literally scribbled pharmacology on my balcony का दरवाज़ा. उसमें मैंने सारा CNS बना के रखा है. I can still study it because it's not getting vibe. That's a different story. Whatever works for you, the best way that you have been using to revise all these years, stick to that. But if I had to give you a new method that you can apply to recall and recollect information is active recall. This single-handedly has changed my revision game. What you need to do basically is, for example, let's say you've studied a topic. तो एक बार तुम उसको पढ़ो, revise करो, and then you close it. And then you write as much as you remember about it. It might sound like it's too much and that it's time consuming, but it's actually not. And you'll see that your revision gets faster if you apply this technique. The third tip to keep in mind is as your days get less and less before your exam, study one single subject the entire day. For example, if you have 20 days left, you can study all the 3 subjects in a single day. But if you have less and less days, and as the days get lesser, basically study a single subject the entire day. So sit and complete a chunk of the portions and revise a chunk of the portions. Create a mini revision schedule. Now don't get flown into the concept of making a timetable. Yes girl, I'm going to make it so aesthetic. I'm going to do this 7 to 8. I'm going to brush my teeth. A simple to-do list कि आज मुझे ये topics revise करने हैं. I have to focus on these chapters and I have to focus on this subject. A simple overlay of what your day should look like and how many topics you need to be completing in that day. Stay calm and consistent. Do not panic. You've given these exams. You will do well. You will ace. Please fix your sleep schedule. Do not be pulling all-nighters and not sleeping at all. That's not good for you. It's not going to do any good to you. Stay calm. Sleep. But whenever you're awake, make sure that you're productive and that you're not wasting your time. So yeah. How to present your paper. I have basically made like a template for you that you can follow. So the thing with paper presentation these days is that it's very specific. For example, they're just not going to ask you myocardial infarction as 10 marks in pathology. They're going to give you a case study. They'll ask you what is the diagnosis for 1 mark. They'll ask you what is the etiology and risk factors for 2 marks. They're going to ask you the mechanism, pathogenesis of MI for 3 marks. They're going to ask you the complications and treatment for 3 marks. So it's well segregated. So it's very easy for you to just write the answer for the specific question and get marks. So most of the part is usually taken care of just because the questions are more specific these days, okay? They'll ask you exactly what you need to write. And if you write that, you'll get marks. But apart from that, here is a general template that you can follow to get more marks. So for pathology, if you have a 10 marker, start with the definition as always. Write the definition for a line or 2. And then write the etiology. For example, atherosclerosis. I don't know why I'm giving the same example. Write the modifiable risk factors, the non-modifiable risk factors. The only thing you need to make sure is that it's very easy for the examiner to correct. You're not writing to show your knowledge. You're writing to let the examiner know that you have the knowledge by presenting it properly. draw a flowchart of for modifiable and non-modifiable and write it very nicely. Then write the mechanism, draw diagrams, leave space, draw flowcharts, make it in a very systematic order. Don't haphazardly write things and scribble and cut. That's all you need to keep in mind. And then microscopic features, most important part of pathology is the pathogenesis and the microscopic features. Remember these points well, remember the gross points well, even the microscopic points well. So you can make a table or however you like. If you want to make a flowchart, that is up to you, but make sure it's clean and it has the information in it. And then you can write the clinical features and complications. So if you write these headings, you will definitely get 8 or 8.5 with the correct knowledge. As for 5 and 3 markers, as I already told you, it's going to be specific questions. The only thing you need to keep in mind is that do not overcrowd your answers. Make it spacious and make it easy to correct. For example, if your question is on pneumonia, write the stages of pneumonia. Instead of writing it in a paragraph, you can make a flow chart or make a table and write the different stages. Stage of congestion, hepatization, resolution. Just do that. So in micro, in general, if you're getting a 10 marker for an infection like TB, malaria or HIV, one line, introduce the disease, whatever it is, and then write the pathogenesis. This is the mode of transmission, the stage of disease progression is there in HIV, is there in measles, your prodromal stage or all of that stage. If you remember that, which you need to remember by the way because it's important, write that, and then you can write your clinical diagnosis and then write microbiological diagnosis. If you get bacterial infection, you can write all these headings, and if you get viral, you can write all these headings. It's there on the screen, you can check it out for later. And then additional points if you write treatment and vaccination. That's it. For pharmacology, if you're getting a 10 marker question on classify the drugs used in bronchial asthma, again make flowcharts or tables, make it easy to correct, write all the drug names, write the proper heading, classify the drugs properly, write mechanism of action, write some important pharmacokinetics features if present. Drug interaction अगर उस drug का है वो ज़रूर लिखना है. If it's synergistic action, please write that for some important drugs, not everything. कुछ important points है, remember that. Along with that, obviously you need to write the uses, the adverse effects, and contraindications if it's there, and optional dose. Somebody asked me in the comments, do I need to remember the dose of every drug? No. You do not need to remember the dose of every drug. The only place I recommend you to remember the dosage of drugs is in emergency conditions. For example, hypertensive emergency. For that, you need to remember the drugs used and the dosage used and the route of administration used. For thyroid storm, for diabetic ketoacidosis. So for these important emergency conditions, if you remember the dosage, you will get good marks. You guys were asking me to make a similar video for first year MBBS as well, which I will. So don't worry. Apart from that, if there is anything else, you can let me know. Make sure to like, share and subscribe. Subscribe to the channel if you haven't already. And that's it. I'll see you in the next one. Bye bye.